So what if the next breakthrough in cancer care, not another drug, but it's making sure patients actually receive the treatment we already know they need? This is true for our friend Becky. Becky was in her early 40s, a young mom, when she was diagnosed with cancer. My wife, Shirley, and I fought to get her the care that she deserved. And yet, with Shirley's background as an oncology nurse practitioner, we were at the mercy of a system that was overloaded, nursing teams that unfortunately were over capacity. And so, unfortunately, Becky fell through the cracks and her cancer progressed. And by the time we got to her surgical oncologist, he had the words no family team shall ever hear. We missed the window of opportunity to treat by 2 weeks. 2 weeks. The treatment existed, but the system simply did not move fast enough to save Becky's life. And so, unfortunately, Becky's story is not unique. In today's modern cancer teams, the best ones, they're still doing this manually. A nurse has to look in 6 different systems, collate all that data together into a spreadsheet tracker, just to reference the protocol, and just to understand the next step for one patient. We know she can probably manage 200 patients, and yet the clinic is overseeing 10,000. You see the problem? No human team can watch every patient, every signal, every day. And every missed signal means clinical risk for the patient and financial leakage for the clinic, often thousands of dollars in missed treatment opportunities each year per patient. Solving this translates a $6.7 billion annual TAM opportunity in the US alone. So we built Preveta, the AI command center for modern cancer care. For the first time, clinics can see their entire population in real time. What Preveta does is we organize and we integrate with all the source systems, we unify together, and then we apply intelligence to figure out which patient's disease is progressing, who's overdue, who is eligible for a clinical trial. And then we turn that agents at that, turning that clinical intelligence into action. Meet Agent Kate, Preveta's agentic nurse. She finds those care gaps and she moves the patient forward. Let me show you. This is an interaction between Agent Kate and a prostate cancer, a grumpy one, prostate cancer patient whose cancer has progressed because Preveta has identified that his blood draw is determined that his cancer is progressing, and now we need to get him imaging ASAP.
Now the next step Dr. Johnson recommends is a PSMA PET scan, an advanced imaging tool that gives a clearer picture. Do you have any questions about that scan?
Wait a minute, I feel fine. I don't need this image.
I understand that you feel fine, and that's a good thing. The PSMA PET scan is a precision imaging tool, like a high-resolution camera that can detect tiny changes that older scans might miss. This helps the care team stay ahead of the disease and preserve more treatment options. Does that help explain why it's recommended?
Okay, so you're telling me this image is going to help me determine the cancer is progressing?
Yes, it can detect very small levels of cancer activity earlier, giving Dr. Johnson a much clearer picture. Would you like us to help coordinate a PSMA PET appointment for you?
Yeah, let's do Tuesday mornings.
Great, thank you for sharing that. I'll note your Tuesday morning preference. I appreciate your time and openness today. I'll be noting your daily Orgovix use, the fatigue you're tolerating, the pattern of your PSA results, and your Tuesday morning preference for the PSMA PET scan. All this will be shared with Dr. Johnson's team, and they'll reach out to schedule the scan.
That's the future of AI in healthcare. Moving beyond the back office administrative functions and into the deep health clinical workflows where patients' lives are actually saved. And it's working. Kate is driving an amazing 68% patient engagement. We're finding cancer progression in 1 in 5 patients and reducing that interval delays from 6 weeks down to 2 days. We're already serving networks of 1,400 providers, 3 million patients, and generating an annual ROI of $4 million plus per year per clinic. We're partnered with 2 of the healthcare giants in the industry, both Fortune 25 companies, in Cencora and Cardinal Health, giving us a strategic path to 5,000 provider networks in their respective areas. We're not building for a single product, for a single disease. We're building a repeatable platform that grows and scales the further we expand into additional specialty areas. And that path puts us on track to end the year at 4 million and over 100 by 2030. I just realized I haven't introduced myself. So I'm Victor Lee, co-founder CEO. And this team has been built for the exact problem. My background, I spent 7 years in the US intelligence agencies building some of the largest data platforms, including NSA's first language model. And since then have built multiple data businesses from the ground up. My co-founder, Shirley, brings the clinical expertise. A Johns Hopkins trained oncology leader, former cancer center director, and awarded America's top nurse practitioner in 2021. Around us is a team of enterprise veterans have built platforms for some of the largest companies in the world. And that talent has attracted capital across US and Asia. So for Becky, unfortunately, the system missed its chance to act. But for millions of patients after her, Preveta is making sure that never happens again. So who's with me and joining me in delivering the next breakthrough in cancer care?